Hey, good morning, Dr. A.
Good morning, Dr. Saylor.
So I'm Dr. Saylor, Dr. Larry Saylor,
I'm Dr. Michelle Afonso.
and we're here again in the month of October, starting to get a little cooler now. And Casey, how are you doing this morning?
I'm good. How are you?
Good. And Hector?
Top of the morning, sir.
Top of the morning. So we have a good topic today that I think will be very helpful for people because it's such a topic of the moment, right? And you know what I'm going to say. It's about,
Artificial intelligence.
yes, AI, right? And it's like you can't go a day without hearing about it. And of course, we try to stay on top of things and look at trends and see what are trends and what are actually trends that are going to affect our business in any way. And really, as we look at, there's a lot of things happening with artificial intelligence as how it's changing dentistry. In a lot of the ways are helping dentistry. In a lot of ways, we don't know what's going to happen. But one thing that we realize that AI has done is we start getting people that are coming in that are all of a sudden they're experts in dentistry. And we realize that what they're doing is if they're about to have a procedure done, they're asking chat GPT about the procedure. And when they come in, they have 100 questions about it. And we don't mind it, right?
We kind of love it.
We love it because we've always said that a patient that has done the research is the best patient for us. And we like that interplay with the patient. We feel that what's difficult sometimes is patients can get overwhelmed and they don't know what to do with the information.
Yeah, that's true. It can give you a lot to ask or think about, and kind of honing that in is what we want to talk about today.
Yeah, so what we have done is we have posed the question to ChatGPT, and we're going to field some of the questions. And I've looked over the questions, but I haven't looked over much, so I'm going to be kind of going off the cuff and just answering them just as if a patient was in the chair asking. And I think these, from what I've seen, are really good questions. And they're questions that are very relevant to the particular treatment. I think, what was the question that we asked ChatGPT?
The question was, I am interested in getting a set of veneers. What questions should I ask my dentist?
Right. And so this is a scenario that we find ourselves in quite a bit. And in the past, I've wondered, why haven't people been asking the right questions? Are they about to do this procedure that is pretty significant in cost and an emotional investment, and they're about to permanently change their smile? They should be asking these questions. So let's jump into it.
Absolutely. So it breaks it down into 6 parts with multiple questions. The first one, what type of veneers are you recommending? So is it porcelain? Is it composite? Is it minimal prep?
Good question. What type of veneer? So first of all, a lot of people don't even know the difference between a veneer and a crown. And the veneer is strictly for aesthetics. It's going to replace faulty enamel on the front of the tooth and sometimes on the sides of the tooth. And so it's much more of a cosmetic procedure versus the crown, which has much more of a restorative procedure that's going to fully cover the tooth. So what type of veneer? The first question is, people most of the time are wanting a minimally invasive veneer. So that is a veneer where ideally you don't even have to touch the tooth. And that's called a no prep veneer. And we always say that there are a small percentage of people that we find that are candidates for a no prep veneer. Most of the time what we're doing is a prep less veneer or a traditional veneer. So a prep less veneer is where you're going in and shaping the tooth, and you're shaping the tooth with a diamond burr, and you are removing enamel, but the key is you're removing a very small amount of enamel. In fact, when you're done doing a prep less veneer, when you look at the teeth, there should be very little difference between the way the teeth appear in a pre-op condition versus when you're done preparing them. And that's always nice because you're still changing the tooth, but you're not putting the tooth more at risk for fracture, or you're not putting the tooth more at risk for decay or anything. And with any veneer, I think the key is that you're staying 100% in enamel.
Oh, I
Right.
see.
So you're staying 100% in enamel, therefore there's no dentin exposed whatsoever. And the next type of veneer, if that was a prep-less or a no-prep veneer, is a traditional veneer. So a traditional veneer, in our case, we're still staying 100% in enamel, but with a prep-less veneer, if the actual dimensions are maybe 0.2, 0.4, 0.5 millimeters reduction at the most, half a millimeter of enamel, that's very, very small. With a traditional veneer, it's maybe 0.3, 0.5, 0.7. So very small difference. But in this case, if you were to look at the teeth after they're prepared, you would notice they're prepared. Still in enamel, and the key to that is what would be the difference, really, if you're in enamel or if you're in dentin?
Bonding. So you can bond differently to enamel or to dentin.
Yeah.
And then sometimes the shade and the color of that natural tooth underneath the veneer.
Right. So in adhesive dentistry, in cosmetic dentistry, enamel's king. So if you're bonding to enamel, it's very predictable. And bonding to enamel, you're most likely not going to have that veneer ever come off because enamel is very easy to bond to. The next thing, what was the other part of the question?
That was the first question. So the next one, kind of moving forward, would be, well, how many teeth would we be working on?
Another good question. How many teeth? What does this depend on?
It depends on the patient's smile, really, and kind of how many teeth they show and kind of what they're looking for.
Right. So I would say typically people think they need 4 teeth done. So let's just play that out. You're not happy with your smile, therefore you want to replace the enamel. Most of the time patients think about color when they think about designing their smile. And as I've said so many times, there's so many more things that come into play. Color is just one small part of it. If you don't like your smile, the job of the cosmetic dentist is to see where in that list of things that make up a great smile, which is smile design, if there are 10 factors, how many of those factors do you fall short on? And color is one small part of that. So we're looking at arch form, we're looking at arrangement of teeth, we're looking at levels of the gums, we're looking at the contours of the teeth, the volume of the teeth, so many things, the quality of the enamel, so on and so forth. And so if the patient comes in and really they have a lot of things off with their smile, but they think they can fix it with 4 teeth, we have to help educate the patient on why, if you did that, although that's a smile enhancement, it may not be the smile that they're picturing, the outcome that they're going to get in the end. And also often the problem that we run into is if they truly only want to do 4 teeth and that's all they need, they want to make those 4 teeth super white.
Yes, and then they can stand out from your other teeth.
Which isn't going to work, and we often try to tell the patient or educate the patient on, if you're wanting to stick with fewer veneers, let's stick with a shade that is more natural, as opposed to a shade that's going to show up as obviously those teeth have been veneered and there are 3 shades whiter than the rest of your teeth. And that's not a good look. But in the patient's mind, we should understand where that communication gap comes from and what do they think they can do.
They can whiten the rest of their teeth.
Right. That let me go ahead and go 3 shades whiter and we can just whiten the rest of my teeth. Which really, as we say, I mean, it can happen, but it's almost like capturing a snowflake. It's like you can get them that white for a very small amount of time, but it may not be sustainable. So we may err more on one to two shades lighter on the veneers and whiten to that, but 3 shades is certainly pushing it.
Yeah, that was a great explanation for that. Kind of encompasses the color conversation, how many teeth,
Right.
a lot of what we're looking
And,
at.
and one more thing to add to that is as I'm talking to you right now, I see your side teeth. And this is the perspective I have because I'm looking from the side. And when you're looking in the mirror, Casey, you're just looking at the front 4, maybe 6 teeth. But when we're talking at a cocktail party or whatnot, those are the teeth that's showing are your side teeth and your bottom teeth.
Yeah, when you're talking.
Your bottom teeth do show. And so it's okay to not do the bottom teeth. In fact, we try to touch as little teeth as possible, but we still want to design it so that you're going to have the outcome of what you're expecting in your mind. So we need to kind of make sure we bridge that gap in your mind and what's in reality, which probably brings up the next question, I would imagine.
Yeah, can I see a preview or mock-up
Yeah.
of what my smile would look like? And that's a great question and something that we love to be able to provide.
And I knew that was coming only because that's the natural progression of the way these questions would work, and it's a valid one. Can I see? And what would you say to that?
Yeah, it's part of our process. When we have a really, really good mock-up in our temporaries, and that's typically where we hone in, we're bringing in the conversation we had about what the patient's looking for, and trying to get those temporaries to look very close to the finals. And it gives a trial run for the patient to have that smile, go home and enjoy it and see what they like or don't like before we make the final veneers.
Yeah, but in that case, Dr. A, I'm already committing to doing the case. Can I see it before you even do that?
Wow. We can do mock-ups in the mouth sometimes, or we do a digital mock-up. There's different ways to do it.
Exactly, yes. So many times what we can do for the confidence of the patient going into the great unknown is, yes, we can overlay the desired effect right over the teeth with acrylic that is reversible. So we can put this on, have the patient keep it for a day, and walk around with it, test it out, and then we can take it right back off. And that's a great way to preview the smile because let me tell you, I can look at it and say, this is going to be gorgeous. That doesn't help the patient. But when I can look at it and know it's going to be gorgeous and the patient's not sure, I can't wait to mock it up. Because in your head, you're wanting a beautiful smile, and in your head, you think that's worth a certain amount. But you don't really know that until we can show you what that is going to do into your life. But if you can walk around with this trial smile and go to the coffee shop and use that smile, that's very powerful, and you understand what that can do for you on the inside, you're ready. And it's great because the patient walks into the appointment excited, and they can't wait for what they're going to receive. And it brings a whole new level of energy to us as well, because now we're in it together as opposed to working on you and you're like, what am I doing? I hope this is going to work out. That creates tension that we can deal with, but I'd rather be dealing with the second scenario where you're excited, you can't wait to be part of that creative process.
Yes, absolutely. Another question that AI brings up is when understanding the treatment, understanding if your bite or your speech will be affected by the veneers.
Another great question. Now, how would you know these questions if you didn't have this, right? So let's talk about that. Can doing veneers affect your speech? Well, I have Invisalign in right now. It's affecting my speech a little bit, right? No doubt about it. And people are in tune with that at different levels. Why has it affected my speech? Because it's thicker And the phonetics are formed with your tongue against the teeth and the airspace between the two. So there's different tolerances for that. And as I said, depending on why the veneers are being done, if the veneers are a small cosmetic enhancement, then you may be adding 0.5 millimeter to the thickness of the tooth. That's most likely not going to cause any problems with phonetics. What if somebody has worn their teeth down and you're adding 1.5 millimeters to the length? Yes, that can affect the phonetics. Is that a no-go? Not necessarily, but is that a case where you'd want to mock it up and try it? Yes, you would want to do that, and you would want to let the patient know that this can affect your phonetics, and you may be able to get used to it, you may not be. So you want the patient to know if 1.5 millimeters is the length that we'd want to add ideally, and you know when you do this, you may have to tighter that, and you may end up adding only 1 millimeter, you're still going to be able to get a nice aesthetic outcome, but you have to dial in just the right amount of that incisal edge position that is now going to help you get the phonetics that you need to where you're not producing a lisp. Very important. Has it happened to me to where we've had to adjust teeth a number of times afterwards? Yes, it has. But I don't worry about it now because I know how to get through that. Knowing this ahead of time and letting the patient know that this is something that we're going to be working with is very helpful for the peace of mind of the patient as well. It gives them confidence that you can work through it. So great question. What was the other part of that one?
Bite.
Oh yeah, the bite. Hey, you know we're all about the bite. So the bite is everything. In fact, I studied the bite, the occlusion, for the first 10 years of my career. That is so important in any time you're doing cosmetic dentistry. Because can you affect the bite by doing the front teeth? Absolutely, all day long.
Yeah.
What if you don't have the room to do this aesthetic enhancement that you want to do, and the patient wants it, but the bite is going to be affected? How could you intervene? How could you get around that?
If, let's say, the situation is the teeth are too close together or crowded and there's not the room, we can move the teeth. And that option might come in as doing orthodontics
Yes.
in Invisalign in most cases.
And that is how I started getting involved in Invisalign, because so many times I'm looking at doing a smile design and I couldn't get there from here without the help of the orthodontist. But the problem is that I'm looking out and I know what to do, but how do I explain that to the orthodontist? And a lot of times it's like you're trying to get a result after the fact. In other words, the patient goes back to the orthodontist does an adjustment, and then you see it 2 months later and you're like, oh no, you over adjusted, or I still need more. And it's kind of ridiculous. So for the general dentist or the cosmetic dentist to be able to do it him or herself is of the utmost value to the patient. And that's how we came about going through Invisalign, is to do exactly that, is to alter the bite in a way that you can not only still get the cosmetic enhancement, but you could also be more conservative on your preparation. That's key.
Exactly.
Great question. Keep them coming.
More on the procedure details. AI wants the patient to ask, how many visits should I expect?
Yeah, that's another good question. How many visits can you expect, and how long is it going to take? And I have my daughter's wedding coming up in 3 days, going to have the veneers by then. First of all, give us more time. Typically, it takes 2 visits, technically. And if we break it down into the details, the first visit is the consultation, right? Which kind of doesn't count, but it does. So you get the first visit, which is the plan, the consultation. The second visit is more the pre-op, collecting all the data, crossing the T's and dotting the I's, measuring 3 times before you actually implement. And then you have the next appointment after that is the implementation, the actual preparation appointment. So we're going to go in and we're going to prepare the teeth and do our prep design,
Yep.
knowing ahead of time what the dimensions of this prep are going to be, having the benefit of the wax up, the mock up, and oftentimes doing the procedure on the model as kind of a dry run, which, believe me, all that stuff happens behind the scenes, and you can believe that the night before we're going through it in our heads what these preparations are going to look like,
Yep.
how the design is going to be, how far we're going to wrap around to the back of the tooth, are we going to go in between the teeth, are there going to be any other things we need to do at the gum line, are we going to use lots of things, right? Where when we go in there, we have a pretty good idea of exactly how this is going to flow. And then after that prep appointment, which is typically about, if you're doing 8 to 10 veneers, let's just say, that's going to be 3.5 hours. You're going to leave that day with a nice smile of, it's pretty good representation of what you can expect your porcelain's going to look like. And then you have your next appointment, which is your post-op. If you're doing a multiple number of veneers, if it's 2 to 3 or 4, we may not need a post-op. It may be a call. How's everything going? Oh, it's going great. Do I need to come in? No, you don't need to come in.
And that's when the patient's in temporaries. We're post-op checking.
Right, in the temporaries. If it's more extensive, yes, we offer to the patient to come back in, and we like that appointment because at that point, we're getting details on, do you have any changes you want to make? How's the color? Do you want to not go up a notch? Do you want to go down a notch?
How's the phonetics?
How have you done with speech? Really, sensitivity is not typically an issue whatsoever. And then the next appointment is the bonding appointment. And that bonding appointment takes how long for 10 veneers?
An hour and a half, 2 hours?
Yeah, hour and a half, 2 hours. Is the patient getting numb for that?
Sometimes.
Yeah, they typically are going to get numb. So we're going to get you numb for that appointment. So we're going to let you know what to expect for each appointment. That next appointment after that is going to be
Another post-op.
another post-op. So that's the way it should be done ideally, which again is a reason why we don't recommend you go off to Mexico and get these done. Are you going to want to go back to the post-op? Are you going to want to go back for the temporary check? Probably not. So we've seen problems with that, and it's to the benefit of you to go back for these post-op visits. And wouldn't you like that if you could do that where you're doing landscaping around the house and you're spending a significant amount of money, and they're doing a pre-op and they're doing a post-op? It's typically not the way it works, right? It's like you're stuck with what you paid for. So we offer that, and it's a benefit to the patient.
Absolutely. All right. Next question. How long can I expect my veneers to last? Really great questions.
Yeah, it's an interesting question. And so what does the literature say? I don't know if you were to ask ChatGPT that, it would probably say 10 to 15 years.
Okay.
Which I think is fair, 10 to 15 years. So it's interesting the expectations that people have, and what have I found? If you're doing a set of veneers, how long it'll last? It's exactly what you said. It depends on their functional risk. So we try to give the patient a pretty good understanding ahead of time. If you have damaged your God-given teeth, what's a likelihood that you're going to have some maintenance of the porcelain that we put on them?
Hi.
Pretty high, right? So that's important to know. If you've come in and your cosmetic enhancement involves replacing lost enamel due to excessive wear, we're going to build it a little bit differently. We're going to prep it a little bit more aggressively. We're going to make those edges a little bit thicker. We're going to use a material that's a little bit more durable. And I would say in that case, if somebody who's a high functional risk has worn their teeth down by about 2 to 3 millimeters, the likelihood of you needing some maintenance in the next 10 years is about 100%. And realistically, how soon are we going to run into a problem? Within the first 5 years. Now let's talk about what that problem looks like. What would it look like? Is it like their smile gets ruined?
Maybe one veneer can chip or break.
And what are we hoping is going to happen if you get that call and says, I broke a veneer? In your mind, you're thinking, oh no, they're walking around with this broken tooth. But in reality, what is it typically?
Maybe just the incisal edge has worn or chipped, or maybe a little bit of the facial surface, so it's
Yeah. And when they come in, you're expecting the worst, and you're looking at it, you're like, where is it?
Yeah.
And they're like, it's right here. Can't you see it? And they're like, oh, I see it now.
Yeah.
That's good. Because at that point, you give the patient the option of, we can smooth that and see if you're okay with it. Or it can be redone. So that's the typical scenario. Has it failed? Technically, some part of it has failed. But the veneer hasn't come off. The veneer hasn't broken, but it's like a new car that you get a ding on it.
That's right.
It's not a great thing if you get a new car and you get a ding on it. If you get a ding on the door because you're at the gas station, you open it up too far and it hits that stupid guardrail. If you just got the car within a year, you're going to want to fix that. If the car is 3 years old, you may be just like, but you learn to live with it.
Yeah.
But you could always bring it back in the shop and they can fix it up, which is what we can do as well. So that's realistically what can happen. And it's typically one of the front teeth that has just a teeny little chip on it. And a lot of times we do dust it off, and then the patient thinks that they're going to need to get it replaced, but then we don't see them again because it doesn't really significantly affect their aesthetics.
Right. Continuing with the AI questions, one that I like here is, what kind of daily care or maintenance will they require, and how do I take care of my gums?
Yes. So because it's an enamel replacement, pretty much anything you're going to do with your natural teeth is the way you're going to maintenance your veneers, with some small exceptions. So we have to qualify that with, what do you do with your natural teeth? If you're doing things with your natural teeth that we wouldn't approve of, you certainly need to be educated on that with the porcelain. So when we talk about this till we're blue in the face, cuticles, nails, tearing tags, chewing on pencils, chewing on straws, don't do those things, right? Be kind to your teeth. We don't want you doing that to the enamel. And if we know the etiology, the reason for why you've ruined the enamel, we want to draw attention to that, so you're not going to do that when you have the porcelain.
Right.
And as far as maintenance goes, if you're going to do the veneers with us and go back to another dentist and have your cleanings, do they need to know that? Yes, they need to know that. They need to be aware of that. They're going to be a little bit more careful with using abrasive substances on the porcelain and changing that surface luster. So they're going to use slightly different pastes and whatnot, and be a little bit more careful with the instruments so they're not scratching the porcelain. So that's important to know as well. Can the veneers get a cavity? The veneers themselves can't get a cavity, but where the veneer meets the tooth can. It's not more prone than a natural tooth to get a cavity, but a natural tooth can get a cavity, and so could that surface of where the veneer meets the tooth, sure. So you have to clean those, especially at the interface where they meet, which is at the gum line and in between the teeth, which means brushing sulcular and flossing. And do they stain?
A little.
A little, but not actually as much as natural teeth. And the thing that we find, and I've had some tough cases where we've seen some weird stains on people's teeth, and now with all these crazy supplements that's out there, for instance, my wife was taking an iron supplement. Her teeth were turning black. I'm like, what in the world is going on? And it's a supplement that she's taking. We were able to fix it, but turmeric, collagen supplements, they can add some weird staining to teeth, cigars, green tea, tough stains. The truth is they come off the porcelain, the stains do, a lot more easily than they come off the teeth. So great stuff to think about. Why don't we take, Casey, how many more? One more? Casey's the voice of reason here, so. One more.
For our last question, let's go with, what is the total cost and what's
No, we don't want to do that. Good question. Total cost, right? So the total cost is always more than what patients think, I find out. But I think what's important about this is it's a serious cosmetic procedure that should be thought of with other things out there in the cosmetic world, right? That you're requiring surgery. And so this is a surgical procedure in that it involves some cutting and it involves a lot of delicate processes with a huge skill set.
Right.
So typically the range of what you're going to see today, and what is today? Important to reference the time.
So today's October of 2025?
Yeah, October 2025 would be the range I'd think you could see realistically $900 to $3,000, $3,500 per veneer. What does that depend on? The market. If you're in LA, is it going to be more towards the $900 or the $3,500 range, Casey?
$3,500.
Or New York. What if you're in Alabama?
Maybe lower.
Maybe lower, right? What if you're in Tampa, Florida?
Maybe some sort of median average or even a little higher.
Right. So it depends on the market. And I don't, Casey, you're in marketing. What is the consumer market that Tampa is right now? Ranking.
We're kind of right there in the middle. I wouldn't call us in LA or New York, but we're not in Alabama.
I think we're technically 11, right? Which is kind of the middle if you were to think. It's like 11. I think Orlando's ahead of us somehow. Nashville's ahead of us. But Tampa's 11. Does it make it right that will justify the fee that you can charge in that market? That is the way it is. So we're kind of limited by the market that we're in to an extent because that's a cost of doing business in that city,
Okay.
which has to do with overhead and all of this, right? But there's a sweet spot there. It's like when I go to a restaurant and I'm ordering a wine, I like to find the sweet spot. The sweet spot is you want to find the market that is right for you, but it's also going to be a practice that may be using the same laboratory as the market that is in LA. So then you kind of get the best of both worlds, right? The dentist loses out a little bit because, in fact, the market that we use, our lab is located in California with the same dentists that are sending them work from Beverly Hills and Manhattan and the very best markets in the nation. We're using those laboratories, and are they charging us less for the work? No, they're not. And then the next question is, what is the skill set of the dentist? So you want to find a skill set of the dentist of somebody who's doing this on a regular basis and has been trained by the top in the market, which we have. So that would kind of be the sweet spot that you want to look at, and then you want to look at, let me see some cases that you've done, and is this something you dabble in, or is this something you do on a daily basis? Those are important questions. So to answer the question, in the extreme market, yes. If you're going to have it done in Manhattan, you better believe it's going to be $3,500 a tooth. If you're having it done in Tampa, Florida, it's going to be more under the $2,000 mark at this point in time per tooth.
Yeah. That
So
was
there
a
you go.
Great explanation. Thank you.
Thank you, AI.
Thank you.